All, this is Dr. Mobeen Sayed from DrBeen.com. Today is once again my favorite day. Today is our Your Questions Answered or the open forum. Let us start our discussions today. I am at liberty to have the comments and to respond to them. So let's start our discussion. So what I'm going to do is discussion is going to be two parts. First, I'm going to give you some updates that I've been hearing, some news that I've been hearing. And then we will go over the Twitter and the questions here in this stream as well. I'm going to try to mix them up, and some questions from Twitter and some from here. Those questions on Twitter that are more elaborate, that needs more detail, and I cannot cover that within short period of time. We'll do that later. For example, one important one is omega-3 for prophylaxis and for long haulers. So I'm going to talk about that tomorrow. Similarly, there are some other drugs as well that people have asked about, Cool Beans have asked about their mechanism of actions. We will do them separately as well. So with this, let's start. And James, I just looked at your name and I remembered you have sent me a couple of questions too. So let me just open them very quickly. These are in the emails. Here. Okay, cool. All right, so let's start. Welcome, everyone. And the thing that we're going to do is, first of all, some updates. So this is Dr. Bean. This is the Twitter thread with the questions. I have the link to this thread. And now let's look at some of the news here. So some interesting things that we are seeing are the following. Number one, Eli Lilly has just released a report in which they said that the antibodies, neutralizing antibodies that Eli Lilly have produced, these antibodies have been successful in some patients, in a small group of patients. Again, not too small. There are about 302 people in it. And then there is another placebo group, which is 150. So not very small, as we've been seeing some studies of 50 people or 60 or 80 people, but still not large enough. So they have a trial done in which they have a neutralizing antibody which connects with these spike proteins and causes the spike protein to become dysfunctional. It cannot bind with the cell anymore. And what they did was, here is a clever thing that they did. This study is done in the outpatient setting. So somebody who just developed the symptom, they are giving them this antibody right away instead of waiting for them to go to the ICU. So this is an outpatient study. It is a double-blind study. That means doctor doesn't know if the patient is receiving placebo or not, and the patient doesn't know if they're receiving placebo or not. And then it's a placebo-controlled phase 2 type of a trial. What they did was, in this one, they gave to some people placebo. Others had 700 milligram dose of the antibody, neutralizing antibody. Some folks had 2800 milligram and some had 7000 milligram. They felt that the most successful dose was 2800 milligram of the antibody. Now, here is what they found. What they found was that, number one, in the placebo group and in the treated group, in both groups, there were no deaths. And again, that is a good thing, because this was an outpatient setting. And most of the patients who remain in outpatient setting, usually they do not develop severe outcomes. So for both placebo and other, there was 0 deaths. However, ending up somebody who just started symptoms and is an outpatient patient, then they end up in a hospital or they end up in an ICU. These were their endpoints. And what they saw was this. In the placebo group, 6% of the people, they ended up in the hospital or ICU. Again, no deaths. So they recovered from there. On the other hand, the treatment group who were receiving the antibodies, out of 302 people, 5 ended up in hospital. That is 1.7%. So this is a 72% risk reduction of a person who develops the symptoms and then ends up in the hospital or in the ICU. So that is a significant thing. So this is what they have found out, they have talked about, and this is their article here. All of these articles that I will show you here are linked in the description as well. So this is Eli Lilly. So if I go down here, this was, we're going to start from here. So Dr. Bean, thank you for the invitation. Are you aware of the Dr. Derek Lonsdale's? He has been working on the subject of thiamine. So let's continue with the news, and then I'll talk about the thiamine. Then the second news, which is interesting, I have a interesting story to tell that my parents used to tell me, and that story was this. So I hope that CDC doesn't become too offended with my story. There was a monkey who became the king of the jungle, and a goat lost her children, babies. So she came over to the monkey and said, "Hey, king of the jungle, can you get me my children? Can you find them?" And the monkey started going up the trees and down, and then the other tree and down, and he kept doing it the whole day. And at the end of the day, goat said to the, I hope I'm pronouncing it correctly, somebody in a YouTube comment actually took pain to analyze my pronunciation for various letters, and they said he speaks Q like poor American, he speaks K like UK. Well, I'm here in the US for 21 years, and this is the best I can do, and I continue to improve and learn, but this is what it is. So the goat asked the monkey, she said, "Where are my kids? You've been, you know that my kids are lost." And the monkey said, "Forget about your kids. Look at the hard work I'm doing. The whole day I went up and down the trees." So sometimes I feel that some of these medical leaders are just going up and down the trees, and the outcome is really not there. So CDC, remember we talked about it, that CDC had said that you don't need to test people who are in close contact with the COVID-19 patients. So that means the attendees or the family members. So then there was an issue, and then they changed it from do not need to, may need to, and now they are saying that you should test them. And they're saying that the asymptomatic attendants of the COVID-19 confirmed patients should be tested. So there is the link from them here, and they say that on September 18, due to the significance of asymptomatic and pre-symptomatic transmission, this guidance further reinforces the need to test asymptomatic persons, including close contact of a person with documented SARS-CoV-2 infection. So CDC took another, I don't know, is it an about turn? But I don't expect this kind of a lost behavior with organizations like CDC. Anyway, so that's that. Then another interesting news on the schools reopening and the surges that are occurring again. For example, in Europe, there is once again said that there is a surge of the cases. And I think all of us know here, the cool beans know here, that the case surge is dependent upon the case testing, right? So the cases can be more or less based on how much we are testing. Of course, it also depends upon how much is the infection spread. But it is the death rate that is real teller for how much or for what is happening in a society. So if we look at Europe here, this is Europe. So if you look at Europe, you would see that their case rate has been going up. So see here. So European Union, this is August, this is June. So in June, the cases were really down, and now the cases are going up. United States, similar kind of a first peak is not finished, and it went up, and then it went down, and it is going back up. But these are cases, and that can be changed because of the testing. I think a more accurate and a better way to look at is the death rate. So this is Europe. So if you see here, this is Statistia, and this is the Europe's peak for deaths. And if you see here, yes, there is, in the last few days, for example, July to August 10, 20, 30, even September 7, 8, their usual death per day are 300, 400. And yes, they did see a day on September 16 when there were 862 deaths. So then there are 600 deaths. And so there is a trend which is mildly up. Again, every single death is dangerous. It is dangerous. I'm saying it is painful. I was talking with someone this morning that Pakistan has opened up their schools, and now they're saying that, well, Pakistan 60% of the population is youngsters. So 60, I think 12 million people are or students are going to go back to schools, and that is going to create a huge wave of pandemic of the outbreak once again. And I'll show you that they are now closing schools after opening them. So the thing that is important is that still this wave of deaths is not as this wave. So that means there still is better management, there still is better control, whatever are the reasons, but there is better control. So saying by the media that Europe has another surge and we have another problem, no, yes, I wish that this never happened, but the number of deaths are still, I think, compared to earlier days, are not there. Then this is Pakistan. So 22 educational institutes closed down in last 48 hours for flouting SOPs. So Pakistan decided to open the schools, colleges, universities on 15th September. So this is like 3 or 4 days ago. And all of a sudden, already they are now closing universities and schools. They are saying that they are not adhering to the standard operating procedures. I just simply think that when you open the schools and colleges and universities, you are going to increase the spread, because youngsters are going to catch it, then they're going to bring it back to their families and others, and they're going to give it to them. So even if they are safe, it is possible that they're going to give it to others. So there is nothing curious about this. This is a natural outcome of a lot of interaction. And then this is the Europe, and then Florida as well. There has been a lot of and again, I have when I'm talking the medicine, I don't care for Republican or Democrat or others. Look at this. Florida daily cases are in this range, 500, 400, 300, and so on. But if you look at the death per day, that is still sustaining relatively lower than the worst times that came in July and August timeframe, but relatively lower, but still high. So number of deaths per day have not reduced, and neither has it gone up. So if the schools were open, for example, and I am against opening the school, I am against sending the children to schools, but the data is here as well. So if the schools have opened, that means more people are going out, more people are interacting, more people are exposed. And even then, if the cases are not going up that fast and the deaths are not increasing, then this is still a manageable situation. I would wish there were no deaths. So this is Florida, and this is another article about Florida. So these were a few pieces of news that I thought that were interesting. Now, tomorrow we'll talk about omega-3. So I'm going to skip the question about omega-3 on the Twitter, and I'm going to talk about it tomorrow. Now let's go back to the Twitter here and the questions. And I'm going to mix questions from Twitter and from the live feed here as well. So please bear with me. So Robert Olney says that, are you aware of Dr. Derek Lonsdale, who has been working on high-dose thiamine? So the question at the end of the day is that, do you think that the high-dose thiamine or thiamine can be used as prophylaxis as well? So definitely thiamine's role that we know in case of inflammation is that thiamine suppresses the T regulatory 17 cells. And I have done a complete video about that. I think it's somewhere over here. A very important and exciting preprint study. This is the one, high-dose thiamine and cytokine storm. So the link is in the description. You can, if you wanted to see the detail, you can see there. But thiamine can be used to calm down T regulatory cells that in turn amplify the immune responses. So yes, even in prophylaxis, let's say if I'm taking thiamine and then I get the virus today, my immune system is going to start responding, and thiamine would keep that in check. So that is not bad. It is good. Then there is a question from Anupama. How come the doctors who daily come in contact with COVID patients test negative for antibodies? So this is a very good question. And I have been having this discussion here in the US as well with some of my friends, that they say, hey, we go out and we treat patients every day. And some of us are afraid that we'll catch it, but we have not. So if they are testing negative for antibodies, that means they never got infected. So either their standard operating procedures were great, or they themselves were very good at keeping themselves clean and protected, or maybe their innate arm took care of very tiny amount of viral load and took care of it. So I think it is going to be different case to case, but it is possible that if you are taking care of the patients and you are very, very careful, you would not get the infection. Then there is a question from Puya Dhagani, smell and taste disorder in COVID-19. So I assume that the question here is that how does the smell and taste disorder work? What happens? So here is the lowdown on that one, and there is a study here as well. So this is non-neuronal expression of SARS-CoV-2 entry in gene of the olfactory system suggests mechanism underlying COVID-19 associated anosmia. So let's look at this very quickly. What happens is in the roof of our nose, so this is the nasal area, correct? In the roof of our nasal area are the smell sensors. So over here, this area has the smell sensors. And this smell sensing area is divided into two parts for structural, for structural analysis. One is called the epithelium. Epithelium is the surface part that is exposed to outside. And then is the olfactory nerve and olfactory neurons, or the nervous system tissue. Now what happens is, if you look at this diagram, this part, the olfactory part, has the neurons that are present here. And then the epithelial part has other kind of cells plus neuronal fibers. The other kind of cells are supporting cells. And what they found was, researchers, that interestingly, the neurons of the olfaction system, or the smell system, the nervous system tissue, does not express ACE2 and the TMPRSS2. So they do not have the enzyme with which the virus will bind and infect the nerve. So it is not the olfactory nerve that gets infected. It is the supporting cells that are present in the epithelial that gets infected. And especially the supporting cells, there is a layer called horizontal basal cells. So this layer, that is a horizontal layer, and they are making basal structure or basal lamina. So basal cell, they have ACE2, they become infected. And then there are sustentacular cells, which are supporting cells. So here, these orange cells are sustentacular cells. These cells also have ACE2 and TMPRSS2 expression. So they become infected. So when these, and the third thing that becomes infected is that the blood vessels that are in this area. So if I take a section of this blood vessel and look at that here, the blood vessels that are in this area, they have pericytes on them. Pericytes are, so imagine if my arm is a blood vessel and it is hollow from inside, in which there is blood. And outside, the covering of the arm is made up of endothelial cells. I'm talking about capillaries. And then imagine my cuff here. This is the pericyte. So this is another layer of cells called pericytes that wrap these cells as well. So these pericytes here are these green cells. It turns out that in the olfactory area, the epithelial area, the blood vessels have the pericytes, which in turn have ACE2 and TMPRSS2 expression. So these are the blood vessel cells become sick, and the supporting cells become sick, and the basal cells become sick. When they become sick, this apparatus, sensory apparatus, does not work correctly. And usually Anosmia is an indicator of a more severe infection, although I have met many patients and treated many patients who started with anosmia and became okay within 3 or 4 days. Here, the problem with the taste, there is no problem. The SARS-CoV-2 actually does not affect the taste nerves or taste buds. But what happens is, for us, when we eat something, the taste is a combination of the taste of the food, or what we call flavor. Flavor is a combination of the taste in our mouth plus the smell. They both combine together to make flavor of the food. And so when smell, the sense of smell is gone, we are now left with one sense only, and that is taste. So that we are not used to. And because of that, when we eat something and we cannot smell that thing and we cannot combine them to make flavor, then we say our taste is incorrect as well. So it is really, the taste is not incorrect, just that the smell is not working. So that is how the anosmia occurs. Now I'm going to go here to the beautiful cool beans that are live right now with me. And while I'm going to talk about this, one request to everyone: we have a cool bean who has been very supportive of Dr. Bean. She is suspecting that she may have COVID-19. She has been holding up fine. She had been taking some supplements as well. So far, her oxygen saturation is fine. She has some symptoms, and please join me. Please pray for her that she becomes okay and soon and fully recovers. Her symptoms have been stable. So just praying for her that she stays healthy and recovers fast. Okay, so the questions here. So there is a question from Aaron. Question: how can Dr. Marek claim there is no viral replication anywhere in the body when RT-PCR only tests the upper respiratory tract? The respiratory system, or the upper respiratory tract, is an indicator of the behavior in the rest of the body as well. This will be rare that we have the infection that arrived in our upper respiratory area, went deep into the lungs, then the replication continued there while the upper area became clear. That will not happen. When the immune system will respond, that response is going to be systemic. The antibodies are going to be present everywhere, and they'll take care of the virus everywhere. The cytotoxic T cells will be present everywhere. They'll go everywhere in the body, and they will take care of this everywhere. The immunoglobulin A, whose job is to protect our surfaces, is going to protect our surfaces in the upper respiratory tract and in the other surfaces which are lower respiratory tract. Then, for example, conjunctiva, then, for example, urogenital surfaces, then the GIT surfaces. So all surfaces will be collectively protected. So this is why it is understandable that if virus is present here, then it is present in other areas too, or it can be present in other areas. It can penetrate and go down. And if it is absent from here because the immune system has taken care of it, then it is possible that it has become absent from the remaining body as well. So good question. Then so the Janet says, oh, I hope the CDC isn't offended. Yes, absolutely. I hope they do not mind me giving an example of a monkey. I think I'll lose my license very soon. So all right, so more questions. So there is a question, I think this is a question, Earth, and do you think that some are of the mind that virus within the herds reduces the elderly and weak, thus saving the US in health-related costs? Interesting comment here, and I can tell you this. We humans are of all sorts. And in this pandemic, I actually saw comments from people who said, this is a great happening. And these are on YouTube. I try to remove as much as possible. I do not like these kind of comments. And I think on my channel, I have a right to remove such comments. But there have been comments that say it is good, it's going to take the weeks out of us, and the remaining society will be healthy and less costly and all that. We are all going to become old as well. So if the general purpose of saying these comments is that anybody who becomes bigger than more than 40, just kill them, that is senseless, cruel, and I think the person needs to go to a psychiatrist. So here, again, yes, you are correct theoretically that if the population reduces, then the costs reduce. But the point of medical services is to take care of population in such times. So I don't agree with this, but yeah, I have seen these kind of comments a lot, and I wonder how do people think like that. Okay, so continuing question. So Jim Mattox, does zinc protect the cell in the nose? So zinc will protect the cells everywhere, because again, it is going to be spread in the whole body. So the body doesn't have compartments. Of course, actually we have, for example, blood-brain barrier we're going to talk about, which is a separate compartment, or there are immune privileged sites. For example, testes are immune privileged site. We don't want our immune system to go and kill the sperms, because sperms are actually, in terms of our cell, they are different. They are haploids instead of duplicate or normal double DNA. They have a single DNA, just like that ova have single DNA. So to our immune system, these cells look foreign. They say, what the heck, this cell has just single set of DNA, must be a bad cell, I'm going to kill it. But these are immune privileged sites. So there are some immune privileged sites where the immune system doesn't go, but usually the products like zinc would be distributed throughout the body. So there's a question here from Hafiz that everything in Pakistan is open, but only schools are going to close. Why? So look, very simple. I have been communicating with Pakistan's Prime Minister, and my point is very, very simple. And that is, there are folks who are essential workers who have to go and keep the lights on. They have to run the country. There are policemen, there are military men, there are doctors, there are nurses. There are so many people who are necessary to keep the lights on and run the country, to keep the economy going. And then children are not going and doing jobs. Yes, I understand that there is a thing about depression and the children at home and not able to flourish as much as they would with their friends and out in the society. But still, children are not going to go work in an office. So why to bring folks out in the society? That would only help spread this and cause more damage. So due to that, and the schools don't stop taking fees. They are taking fees. They're just teaching the children at home, which is fine. But anyways, the schools are open. Logic question. Can you do a video on alpha lipoic acid? Okay, we'll do it. We will do that. What other questions are here? JTJ have a question. There was a study by, excuse me, my cough has become much better. The smoke has really subsided, but just tiny irritation. There was a study by Ariel Israel that showed particular benefits from vitamin D drops used by mouth, which seem to offer much more protection than pills. What might cause that? So the floor of the mouth, and again, I'm assuming here that these vitamin D drops are to be kept under the tongue, for example. So what happens is the floor of the mouth has a very rich venous supply and blood supply. And when we put something on that floor, just like we give drugs in the cardiac emergencies, that drug will become absorbed very fast from the blood system and taken directly to the heart and this in the circulation. That is one. Second, when we eat something, it can actually take a few hours to become absorbed. And when something is absorbed from a gastrointestinal system, it first goes to liver. It has to be metabolized in the liver, and sometimes liver would destroy some part of that drug that we have taken or that substance that we have taken. So to bypass the liver process. We can inject, we can give intramuscular, we can give subcutaneous, we can give intravenous, or we can also give oral drops as well. So oral route has blood supply from here. So from the floor of the mouth, the things get absorbed, they become part of the blood supply, and then directly go into the system. Good question. I'm going to answer, there are a couple of questions from James Kelly. So one question here is, I have heard the term furin cleavage associated with COVID-19. I assume it has something to do with the spike protein. James, I could not research the furin cleavage. I will look it up. Second question was, Dr. Marek talked about the COVID-19 virus starting to die after 5 to 7 days, but it left behind a massive number of debris, genome parts. I assume this is causing a dysregulated immune system. Has this been seen in other viruses as well? So yes, this observation is true for all viruses. However, what is interesting is that somehow SARS-CoV-2 is replicating very fast. It is dividing and becoming, we don't use the term divide for viruses, but it increases in number very fast, and it causes the symptoms in a very aggressive and rapid way that we have not seen with other viruses. As you can tell, this has become an issue because within 3, 4, 5 days, it just causes such a lot of damage. So this is true that viruses can be cleaned up and killed by the immune system, that they can be sitting in the phagocytic cells, for example, macrophages or dendritic cells, and they still need to be turned over and cleaned out those cells, and the virus is there. But SARS-CoV-2 just has huge quantities, and so that is unique to it. Then there's a question, I'm wondering how you and your family are doing prophylactically in this COVID lockdown, psychologically in this COVID lockdown world. I live alone, far away from kids, and it has been a challenge keeping a healthy mind. You are a huge bright spot of sunlight in my days. So first of all, I am honored, I am blessed to be of value to you, James, and to anyone who has taken any benefit from these discussions. I'm blessed. Maybe this is my saving grace. Now, psychologically, it is interesting that, so we are 4 family members, myself, my wife, and 2 children. One is 26 and one is 23. 26 is a software engineer. The whole day, he's just talking and doing his thing with his team members. So he's fine. Younger to him is studying, but they both play video games and talk with their friends. And even before the pandemic, their trends with the new generations were online interaction more than the personal interaction. Myself and my wife, I have been busy with this work, and this work is actually a full-time job. I have to look at the studies, I have to make sense of them, go look up the mechanisms, make sure that the mechanisms make sense, make sure that there is less of the bullshit in the articles or studies or preprints, and I have to figure this out. So that keeps me sane and active throughout the day. It is the evening time, once I've done with the lecture, and then I'll do attribute, and then I'll share this, and after that, all of a sudden the day goes down and there is nothing much to do. And how much Netflix can you watch? So my wife and I go out every day, once or twice. We just go out. We call it going to home office, and that is we go out 2-3 miles and we just circle back and come back to home. That is one that we do. But yeah, it is a tough time. I was talking with my wife this morning, and she was saying, sometimes I just want to sit down in a car and just keep driving. And she has never said it before. So that was sort of a indicator that we are claustrophobic. We are, stuck in the home, and you can't meet others, and normal life is disrupted. So that is still there. She stayed sane during this time because she studies animation, and she had her final semesters, and she was preparing for the test and the animation role and all those things. So she was busy with that. So I think these were a few things that kept us going. But it is a tough time. So with this, let's continue. So there is a question here. Dr. Bean, could you please comment? There is a double-blind study that shows increased risk of non-influenza viruses after getting flu shot. I'm confused whether to get flu shot or not. So number one, please get flu shot. Number two, please send me the study. I'll look into it and I'll be able to comment on this more. Now let's go to Twitter for a second and see what is next there. So smell and taste, we talked about it. Thiamine deficiency seems to have many symptoms. So this is covid.us.org. In common with long COVID, is thiamine a possible prophylactic or treatment for COVID, long COVID, or long haulers? Also, I've read that benfotiamine is much better for treating thiamine deficiency as it is more bioavailable. So short answer is that yes, thiamine does seem to manage inflammatory amplification by suppressing the T regulatory cells, 17 cells. So given before or given during, it is going to be beneficial. So that is one. Secondly, yes, benfotiamine is actually much more bioavailable. So I have an article here. So this is benfotiamine, and there is an article here as well which shows that the benfotiamine is actually, so thiamine is normally water soluble. Here in this form, thiamine is lipid soluble. So it becomes much better absorbed, much faster. It absorbs faster in the GIT, about 3.6 times faster than water soluble thiamine. And secondly, it has better metabolic activity as well. And thirdly, it can enter our nervous system tissue much faster than a water soluble equivalent. So it becomes better bioavailable. So yes, your question is, the answer is correct that benfotiamine is better than water soluble thiamine. But that means if you do not have access to benfotiamine, then take the water soluble thiamine. If you do have access to it, that will be awesome. Matt says, question, what do you think of the use of protease inhibitors for COVID? I know that WHO halted it. So let's very quickly look at this question. So what we're talking about is the following. In one of our previous lecture, we have done this discussion that when the COVID-19, the RNA enters our cell, it is going to use RDRP enzyme and make more RNAs, and more proteins will be formed after that. Now, I had done this discussion that imagine that the protein that is made, which is the virus protein, is actually one large chunk of protein, which has small cutouts. You know, just like children go and buy cutout animals or they cut out soldiers, and so they are in a sheet and then they take them out from that sheet, they break them out. Or there are stickers that are in a sheet and you peel various animals and other things from the sticker and they are the real thing. So imagine that this huge thing is a big chunk of protein. This big chunk of protein itself is useless, but it has smaller cutouts in it, which when you take out these cutouts, these are proteins that can be functional. So viruses, when they enter our cell, they will make this large chunk of protein. Then they would have proteases. Proteases mean proteases. These are protein breakdown enzymes. These proteases enzyme are going to take out the pieces of protein that need to be the active pieces, and then they will make them, allow them to be active. So one way to block a virus is to block the proteases, these enzymes. So when these enzymes cannot work, then this sheet with the cutout of various functional proteins will not be cut out, and the functional proteins cannot become separated from the big chunk of protein, and they would not work. However, in case of COVID-19, somehow this has not worked very well. So this is a article. I have left the link in the description that discusses the proteolytic enzymes and COVID-19. However, yet we haven't found some decent antiviral that would help here. Now I'm going to go back to the Cool Beans live here and see if I can answer some questions from here too. Janet says, Luffy approves. Yes. Luffy had been quiet for some days and now he has started talking again. Question. So there is a question by Madhusudhan Rao. Can novel coronavirus mutate into deadly form? It's already deadly. It causes such a lot of damage. Can it mutate further? Remember, I have been talking about this a lot of time. If a virus becomes so much mutated that it becomes much more aggressive and fatal, then the person who would catch it or will have it will die with, and the virus will die with it. So the virus will not be able to spread faster because whoever it will go to, they will start dying. On the other hand, if a virus becomes too weak to be able to do anything, then that virus is going to die in that person as well, where it got the mutation and became the weak virus. So virus will have to be, the selection will have to be of a virus type that can continue to spread. And that would only happen when the virus only causes mild symptoms, does not kill people, and is also able to replicate and spread. So in theory, yes, and it is possible. For example, if I get the virus today, there may be real aggressive strains that are made. And if my immune system could not take care of them, they would kill me. And when they'll kill me, the virus would die with me. Spanish flu did because it was contagious. Please comment on this. So I hope this answers the question. And I have done 2 or 3 videos about is the virus becoming weak. So please look up the video in my channel which says, is SARS-CoV-2 becoming weak, L and S type? And I have discussed this in detail. So there is a comment here from Charles Kimani. No one is talking about Tanzania where they have no masks and filling up sports stadium, no increased cases. Please address this, my medical guru. So I did not know this. I will look it up and I would then discuss that. I'm just looking through this for questions. Okay, so Logic says, question, do you believe that quercetin, zinc, NSE, vitamin D, all will provide enough protection to prevent hospitalization in high-risk patients? So, you know that there is nothing deterministic at this time. We cannot really say that there is something that would really solve the problem. My observation is that those folks who had been listening to our videos, and I'm going to ask this from Cool Beans as well, just like I mentioned today, one of the Cool Beans, she is sick. Hopefully it is not COVID, but even if it is, then hopefully she recovers in a day or 2 and we are all good. Let's pray for that. Let's pray for her. The thing is this, people who have been taking these have fared better. Why do we not have studies? Just like hydroxychloroquine, people keep saying we do not have a mechanism, and by we I mean WHOs and CDCs and FDAs. They do not have a mechanism to understand the bigger community and see what they are going through. If I am taking supplements and I took care of the virus at home, they have no idea. So I don't become a number anywhere. They don't talk with the outpatient doctors, for example, Dr. Zelenko or Didi or Mubin or someone else, to say what are your experiences, what is your data, and then collect that together and say, here is an observational study of the data from outpatient. Because of that, the outpatient management is still all kind of doctors telling each other what to do and observing patients becoming better without these becoming documented very well. So in my opinion, there is a lots of benefit from these, high risk or not, but I don't have a study to say this is how it is, other than individual studies for vitamin D or zinc or NSE and so on. I take these things. Okay, so so I'm going to go back to the Twitter for a second. How is everybody doing? We are 47 minutes into it. Are you guys all happy and enjoying? So I'm going to go to Twitter. And so if I continue here, Matt says, question, what do you think of the use of protease inhibitors? So that's what we just discussed. Truly brilliant and informative. Thank you, Rob, Florida. Can you please tell Dr. Marek that he was outstanding? That's my question. Seriously, the two of you were amazing, incredible substance. I have sent this note, I copied it, and Rob, I sent it to Dr. Marek today. So hopefully he would respond. He had already sent me a couple of notes as well. So if I go to my emails, Dr. Marek had sent me. So let me just read a couple of those that were really interesting. One, he had sent, so somebody wrote to Dr. Marek, respected Dr. Marek, greetings from a very small hospital from rural India. The day I finished my MD and started critical care practice, Dr. Marek has been the idol for me. From beginning of COVID era, everyone at my place was horrified, but I kept an eye on what you disclosed. Dr. Marek, thanks a lot for the Math Plus protocol, sir. No mortality to date. Huge respect to you, sir. Deepak Sharma, MD, IDCCM, FCCS, India. So similarly, he had sent me one more where somebody was saying that we should nominate Dr. Marek for Nobel. And these were the comments here in the YouTube as well. What is surprising for me is that even when we all know that Dr. Marek's work is useful, his video is still at 10,000 views. I think we should spread it as much as possible because there really is a solution for hospitalized patients. I think on the prophylaxis side, we still need to kind of add some things, probably some of the things that I have discussed. And then on the long hauler side, we still have to learn more. But he has something that would save lives, and it should become popular. Okay, so Rob, thank you for your comment. Tijo P. Thomas says, what is your opinion about in vitro studies suggesting that in vivo high dose requirement of ivermectin to be effective? So I have that here. This is a study which was shown in that Twitter comment. Safety, tolerability, and pharmacokinetics of escalating high dose of ivermectin. So here what they had done was they had given up to 10 times the approved dose of ivermectin to various persons and saw that there were no side effects. So I totally agree with it, but at the same time, I cannot generally say to give high doses. I have to stay limited in the parameters that are known and where safety margins have been studied, and I have to be there for the time being because of the CNS effects that this can cause. But here is a study. It says that even up to 10 times the higher dose, there were no CNS effects, or the CNS mydriatic effect, that is dilatation of the pupil, that they were the same as placebo, meaning no effects. So in general, I would tend to agree with the high dose. I need to have better understanding. Here is what I do. And again, this is not a prescription for anyone. This is what I do with my patients. I give them ivermectin 6 milligram BD. So it is 150 microgram per kilogram body weight to 200 microgram per kilogram body weight. So I look at the patient, I understand what their the weight would be. Most of the time, adults come in 6 milligram twice a day. I give them for 5 days. So that normal dose is ivermectin 6 milligram once, but I give them 6 milligram twice a day for 5 days. To some patients, I give them 6 milligram once a day, every other day for 3 or 4 days. Depends upon the patient's condition and their health and their body type. So I adjust it, but I give a little higher than what normally is given. Kirit Patel says, what is the role of methylene blue? So Kirit, this is one question that I could not research, so I would have to look it up. That is the same one here as well. So this is a trial. This is very interesting. This is an Eli Lilly based trial as well. So here is what they did. There is a drug by Eli Lilly. That drug is called baricitinib. It is a tumor necrosis factor inhibitor. It's an immune system cytokine, which this monoclonal antibody or this drug inhibits. Eli Lilly has done this research and trial, and they came back and they said baricitinib with remdesivir is a better combination than remdesivir alone. So I haven't now seen the data. They say that we will publish the data. We have gotten the results. They are good results. But because I haven't seen the data, I cannot really say how much better, why was it better. But it seems that they're saying it is better. I'm going to go to the live side here and see if there are questions. Jim says, I have extremely high vitamin D3 levels. Could my blood be tested with COVID? I didn't understand the question, Jim. I'm really sorry. Could my blood be tested with COVID? Yes. I missed the point of connection with the D3 levels. Question. So there is Gina says, Dr. Marek seemed to say second half of COVID after day 6-7 was about suppressing hyperactive immune system with steroids and clearing debris. So NSC and vitamin C is useful all the time. Is that right? That is correct. Many of the drugs that would calm down the immune system will be useful throughout. Yes, in the early phase, it is the virus that is replicating more. So at that time, antivirals are more beneficial. However, then comes a time when the immune system starts becoming dysregulated. Excuse me. At that time, immune system suppressors or modulators are going to be useful. So the thing is this, if immune system modulators, which are not of high power like steroids, are given even in the beginning, they would keep the immune system in check. So it is fine. Ulfa intent. Question, can virus injection from ear to eye? How the pathophysiology, and when we ask or wear something, how long the virus stay there and what should we do? So yes, the virus, when it is present in the air, can stick to any of the surfaces except skin. It cannot penetrate our skin because the skin has dead cells on it. So virus will come, get stuck here, and then will be dropped off with the dead cells. But if it, excuse me, if it goes to our skin, not skin, the surfaces like mucous surfaces, the wet surfaces, over there it can hold on and then penetrate and then get into our tissues. Eye being one of them. So it can actually connect with eye. So this is one. Logic says EGCG is more powerful of a zinc ionophore, but everyone focuses on quercetin. Do you know why that is? I think it's just a matter of we talking about it. For example, excuse me. For example, I have not talked about EGCG at all, the green tea and this. So I think we should talk more about it. It's just that it didn't get enough press. M. Gregory says, silly question. I have long hair to my waist. Does COVID bind to hair easily? That's a good question. I think contamination, for example, the snot, for example, it's a gross example, but still snot, if it is on the hair, then it is on the hair. Or spit, or saliva, if it is on the hair, it is on the hair. So there it can survive and it would die within the normal range of its death time. Can it bind and enter the cells? No, because the hair are made up of keratin, so they are not living cells. Excuse me. So Brenda says, you're such an awesome teacher and researcher, one of your cool beans. Welcome, cool beans. I love my cool beans. I am one of the cool beans as well. It is reasonable to believe that if everyone took D, zinc, quercetin, C, the virus in the environment would be less and the pandemic would not be. If we have mask and we have supplements, I think we have a much better chance of reducing the R0 that is spread and having a better resistance and reducing the people who end up in ICUs with these things. Logic says, if you could do your life over again and you couldn't choose software or medicine, what would you do for a career? So Logic, very good question. Do you know that I always wanted to be a painter, the fine art painter, or a musician? So I play sitar, and as you can tell, I do paintings as well. So if even today my bills were paid, I would become a painter. I love poetry. I write poetry as well. I love painting. I love music. So these are my. Okay, so Jim, question: can my blood be tested to see if I have more resistance to catching COVID because of my high? Yeah. So this is a good question. Nowadays, there are many essays that are coming up where people's propensity for higher for severer COVID-19 can be checked. Although they're not available in labs, they are still in the research. Number one. Number two, I haven't yet seen, we have seen that vitamin D, high dose vitamin D study that shows that the risk becomes very less. But can we take somebody who has high vitamin D, put their blood or their tissue cells in some culture, then try to infect them and then see what happens? Such studies are not there. It is a good question for a study. So this is something that a university or some folks should sponsor, and a study should be done because it is a paramount and a very important thing to figure out and understand. So good question. Don't have a good answer. Ganesh says, Doctor, thanks for all you're doing. I have strongly recommended your Facebook page to the Medical Council of Guyana. I have shared your thank you very, very much. Logics. Today, Logic is the dominant question asker. Can you do a full video and possible prophylactic options? No promises, of course. Of course, I was thinking about that, to do a prophylaxis video. I actually received an email today. I don't want to show the document they did, but what they did was they watched my videos and they created a document of various phases and what are the treatment options, and they wanted to present it to Trump. That is why I don't want to show it. I don't want to steal their thunder, but that was a very interesting document. Okay, so going to Twitter for a second. So have you looked into the probiotics? No, I have not. I am very curious about it, that do they have any role with COVID-19, but I have not seen them yet. This also, so Jonathan says that how about the vanishing the small quantities of doxycycline and azithromycin that could eradicate cancer stem cells? Would a combination of these two antibiotics have a comparable synergistic effect for treating COVID-19? Jonathan, great question. I have not found anything. So in theory, yes, but I haven't seen any studies. So for me to say deterministically that yes would be wrong, but in theory, yes, it is possible. K-pop Super Strong says, we just had Dr. Merrick and Dr. Herrera for the talks. Quick testing and early treatment can save lives, but why aren't they being interviewed in mainstream media? Mostly in YouTube is where their platform is. What could be the problem? Conspiracy theorists had more airtime, like what the heck? Absolutely. I sometimes talk with my wife and I say, I don't wear a tinfoil hat. I don't propagate conspiracy theories. I talk about medical concepts. Still, videos with G5s or such things are much more popular, and people are more receptive to watching and listening and thinking about them compared to videos where there may be medical concepts that are useful. It is the same thing, I think, with media as well. Even with the just a few minutes ago when I was talking about the case surges in Europe, that is a beautiful heading for media to create that um, um, irritation in us and create that curiosity in us to go and read it and watch it, and they get more clicks and they get more revenue and so on. So what I'm seeing is that media, pharma at this time are not really caring for what is the right solution to be. They are not being journalistic, or they are not being health professionals. What I've seen is that once, I'm a businessman as well, I would love to earn as well. But I've seen that big businesses lose that humanity from them, and they become all about money. And so when such a time comes, it it is actually an opportunity for them to grab money and to grab attention. So folks like Dr. Herrera or Dr. Marek, they are kind of a anticlimax for them. They'll come in and they'll say, use this and you're done. So then how would they create this daily news cycles? So I think that is the reason. That's my opinion. I may be wrong. Rob from Florida. Dr. Marek spoke about benefits of omega-3. So Rob, I will do a separate video tomorrow about omega-3. Michael Neji says, after being vaccinated for SARS-CoV-2, thus gaining a high probability of being protected from the disease, would there be any reason to still have to wear a mask after being vaccinated? I really want to get rid of my mask and get back to normal. Is that realistic? So short answer, yes. A little bit more longer answer is that sometimes wearing a mask may just be a social thing as well, where you may not be able to tell everyone that, hey, I have become vaccinated, I am okay. You may not be able to carry your vaccine certificate or antibody certificate to say, look, I'm fine. So in social settings, it may be courteous to others to wear a mask just to say that I care. But technically, if you have become vaccinated, then you are neither transmitting nor receiving, then mask is not necessary. Dr. Hussaini says, once again, you missed my question. So Dr. Hussaini, your question was in a different Twitter thread, and I usually just look at the thread where the questions are. So thank you for putting this here. The question that you have is, how about HMGB1 and COVID-19 with fasting? So I looked it up here. This is HMGB1. And then here is a study. And the concept is this. The concept is that our cells, when they are under stress, they release chemical substances. These substances are alarmins. They cause alarm to the other cells, just like interferon gamma. So the HMGB1 and S100A8 and A9, these are alarmins that are released from the cells. And I'm going to connect this to Jim's question before, that he was saying, can my vitamin D level are high? Can my blood be tested for what would happen with COVID-19? Here is a test. This study finds that S100A8 and A9 chemical substances, if they are increased in our body, that is an indicator that the person would overwhelmingly respond with their immune system and end up in a hospital or in an ICU. So in this study, they said that so they're telling the medical community to say, start doing tests of these substances to see who has a propensity of becoming severe, and then give them special attention. So Dr. Hussaini, that much is what I found. I will do some more research. Cindy says, let's actually do this one. Cindy says, can you please explain the blood-brain barrier? So very good question. Let's look at it. So here, this is a blood-brain barrier. So what happens is this. Imagine this is our brain tissue, right? So this is our gray matter, our white matter, our brain. So this is inside the brain. And this is a blood vessel that is inside the brain as well. What we do is we do not want the blood products, like in other tissues, to come directly in contact with the brain tissue. That includes the chemical substances, that includes the viruses present in our body, bacteria present, and so on. So what happens is our, our blood vessels of the brain have a special set of coverings on top of them, which protects the things from which are inside the blood vessels to get out. It prohibits them, it stops them from getting out and going into the brain tissue. And that is what is called the blood-brain barrier. So let me just show you how it works. In a normal tissue, so let's say our lungs or our heart or our liver, other tissues, if this is a blood vessel is made up of cells, correct? So let's say this is a blood vessel, it has cells. The cells have gaps between them. So let's say this is blood. From these gaps, various molecules and nutrition and viruses and bacteria and the immune cells, they can come out and they can go in the tissue. This is not allowed in the brain. In the brain would decide what can diffuse from here to outside. For example, some nutritions, glucose, for example, oxygen and carbon dioxide can diffuse and move. If brain needs anything else, it would say, I am going to provide a special door here through which I will pull what I want, but I do not want free access of the blood system to me. So then what does brain do? Inside the brain, the blood vessels have multiple coverings on them that are not found in other parts of the body. What are those coverings? So if you see, this is a blood vessel cell, endothelial cells. All endothelial cells outside the brain and inside the brain, they have a basement membrane or another covering on them. Think about it this way. If my arm here, if this is a blood vessel, then this shirt on it is the basement membrane. Then in blood-brain barrier, there are more cells on top of them. So imagine if I am wearing a jacket, on top of it, then there is another layer of cloth on this shirt, and let's call that pericytes. Now, one more thing, that the blood-brain barrier cells, these cells, endothelial cells, they do not have junctions in them. Normally, the endothelial cells have gaps in them through which things leak out. The blood-brain barrier, the blood vessels in the brain, their gaps are closed. So they cannot leak substances. So these are called tight junctions. So there are tight junctions present in the blood vessels there. Then there is basement membrane. Then there are pericytes on top of it. So one more layer of protection and stopping the substances from moving. And then finally, there are cells that are called astrocytes. Astrocytes are cells that are support cells in the brain. These cells, if I make a little tiny astrocyte over here, the astrocyte is going to look like this. This is the cell, and it has huge tentacles. So Luffy is here. It has tentacles. Those tentacles have these little pods at the end, and they look like stars. That is why we call them astrocytes. So these end pods or the foot processes, they actually wrap around the blood vessel and further seal a blood vessel from substances to come into the tissue or go to the blood vessel. So with this huge number of protections and sealings, our blood material cannot easily get out to the brain or come from the brain into the blood system. Now brain would selectively decide what it needs to take. This structure is called a blood-brain barrier. So that was a good question. A quick question here for Nina Kant. Nina, first of all, thank you very much for all the cool beans you make. They are awesome. Question, tart cherry juice added to cool beans prophylactic since it is great anti-inflammatory. So yes, so I have a link here about the tart cherry juice. It is supposed to be anti-inflammatory. The only problem is how much anti-inflammatory we don't know. What is the right dose? What should I need if I am going to develop the inflammation? But yes, it is an anti-inflammatory juice. So if you wanted to add it, please do. I'm going to go to the live chat here for a second. I hope you guys are holding up fine. This is 7:12, 1 hour, 12 minutes. So there's a question. Shahida Akhtar says, can't a vaccinated person spread virus by his, her hands like other people? Absolutely. So if, for example, I am vaccinated and then I touch a surface where there is a fomite, somebody's snot is there, and I touch it and then I touch some other place, I am going to move it. Yes, that is going to happen. Now, can I have the virus and then can I transmit that? That may not be easy if vaccine has worked correctly. But yes, other than that, if we are not hygienic in our habits, then we are going to move things around and we'll become transporters of these. So good question. There's a interesting question here. There was no great vaccine for SARS-CoV-1 or MERS. Dr. Fauci has. So I didn't understand the last part, but for MERS and SARS-CoV-1, CanSina, I believe, from China and Oxford were actually making vaccines, but the virus went away before the vaccines were finalized. So they never then continued to make them because these were useless. This is why Oxford was able to make the vaccine faster this time, because they had already done a lots of preparation and project planning and lots of material creation. So Jim says, question, I believe that vitamin K1 is the only vitamin K that can pass through the blood-brain barrier. I am not aware of it. I'll have to look it up. But if it does, it's awesome. Yeah. So Anthony says that bradykinin breaks down the blood-brain barrier, or it opens up the blood-brain barrier. So look, bradykinin is an inflammatory protein. So inflammatory proteins function is to loosen up the epitheliums and endotheliums, and to cause pores and holes, and so that easy fluid and cell mobility can occur. So when the blood-brain barrier will swell up or break down, it would cause free movement of substances, and that is what happens. Meningitis is a type of blood-brain barrier. It is not. It is called blood cerebrospinal fluid barrier, but in that, this is what happens. So you are correct, Anthony. Okay, so I'm gonna. So there's a comment from Joe. Alas, Dr. Bean, the art world's loss has been the Cool Bean community gain. Absolutely. I have been doing so much art here with the Cool Bean community. I love it. All right, so here, Roshan says, does time of immunity to disease depend on its severity? Time of immunity to disease depend upon its severity. So I guess what Roshan is saying, that if I would call it viral load more than the severity. But what would happen is, if the virus load is more, or if our immune system is weak, and we cannot handle the virus, or virus replicates too much, then that would cause the severity, one. Or second, when the immune system becomes dysregulated, that is when the severity would become more. Now, the interesting thing is this: it is not necessary that in everybody immune system becomes dysregulated. Just like allergies do not occur in everyone, there are some folks who respond overwhelmingly. And so that is a situation. We have some reinfection cases of asymptomatic people in Mumbai, both times asymptomatic. That's an interesting one. I haven't yet seen reinfection, which is really a reinfection. No symptomatic people have reported reinfection. So what you're saying is, if somebody had a higher viral load and they developed symptom and their immune system responded with aggression, then they cannot become reinfected because they have better immune system readiness. And if they are asymptomatic, then they can become reinfected. Reason that somebody is asymptomatic is because there are other wings of the immune system that took care of it. For example, innate arm, natural killer cells, cross training of the innate arm, cross reactivity of the innate arm, then the cytotoxic T cells, which cannot be seen with antibodies. So, Roshan, there are many other reasons for somebody to be asymptomatic in addition to having low viral load. But if a person develops the immune response, then they have the immune response. Ideally, with the coronaviruses, reinfection is not seen. Yes, there was one case which we said fine, 1 in 26 million. But it would be great if you can share some more data on if these were really reinfected. Lisa Bowl says, by now, all cool beans could almost diagnose ourselves when we were infected with COVID without testing. My question is, what would you personally do the moment you know you got COVID, assuming you can't get hydroxychloroquine or ivermectin or steroids without prescription? This is actually the same situation that I saw with the cool bean who became sick. I hope that she doesn't have COVID. So the things that were happening before, I believe, she was taking vitamin C, vitamin D, zinc, I believe, or not, I forgot. But my request to her was, number one, please do prone positioning. That is, you lie down prone and you take deep breaths. That really opens up the lungs, the posterior areas behind the heart, and they become functional and they take part in the body's function and oxygenation, and that becomes good. So that is one. Second, quercetin, zinc, vitamin D, vitamin C, thiamine, these are all important to be taken. I think that in the US at least, this is all what we can do. I wish there are doctors who can give ivermectin or hydroxychloroquine and they can give them freely and they can look at their patients and observe them and manage them as they should need to manage as a doctor, instead of their hands being tied. So, Lisa, the answer is I would wish to have hydroxychloroquine and ivermectin available to give to others and to myself. But in the absence of that, the best is use quercetin or EGCG with zinc, and then vitamin Ds and vitamin Cs and melatonin and thiamine. And I'm going to look into omega-3 oils as well. So those things. In some patients, what I have been seeing as a general practitioner is there are signs of lung involvement without the patient complaining of cough or dyspnea, only fever, headache, malaise, sore throat, any explanation. So there are a couple of things that are very important. And that is, the first thing is, remember, pneumonia is of two types, atypical pneumonia and typical pneumonia. Atypical pneumonia is also called viral pneumonia or also called walking pneumonia. Walking pneumonia is where the virus causes interstitial tissue or the tissue of the lung damage. And that patient can, because there is no congestion developed in the alveoli, there is no fluids accumulated in the alveoli, there is no damage to the respiratory membrane, that is a lot of damage. Patient can still continue to walk and their chest X-ray looks clean and neat, while they are developing slow damage in the interstitial area, which would eventually damage the respiratory membrane. So during this time, even when their oxygen level goes down, they are still very tolerant and they don't know. Their body continues to adjust. So that is many times with the viral pneumonias, this happens. And this is why we call it walking pneumonia. You're walking about and you don't know that you have a pneumonia. If you have a non-walking or bacterial pneumonia, you are in a bad shape. You are coughing and there is sputum and there is fever and there is malaise and tiredness. So this is a virus. So that is why it is possible to have walking pneumonia. Here, what is the mechanism of loss of smell and taste in some of the COVID-19 patients? Some of recovered patients still did not regain smell. How to manage these patients? I know some have anosmia for about 2 to 3 months. So I have described the mechanism of anosmia. I think it really depends upon the patient's health. I have seen patients recovering from anosmia within 10 to 12 days and sometimes more. So you just have to wait and keep giving them anti-inflammatory so that the inflammation here is reduced, and keep giving them zinc and quercetin or EGCG maybe to keep the viral loads less. And then anti-inflammatory, for example, in the long haul state, I believe steroids or omega-3s or melatonins or statins are very, very important to reduce inflammation that would cause the anosmia to come back quicker, or to go away quicker. And then one more question, I think this is the last one. From my experience, I notice a lot of families of COVID-19 patients do not get the disease, although they do not take precautions and not isolating their patients. Any comments on that? And that is a beautiful question, because I have seen that as well. I have also seen that many times my patients call me and they say, I have it, my sister has it, but parents do not have it. Or they say, my parents got it and I do not have it. And that is they're not wearing masks either. So is it because they got exposed to lower viral loads and they developed the immunity? Or is it because our 81% of the people are going to just recover without any huge deal? So maybe that is the problem. Is it because they developed the asymptomatic state where the natural killer cells and cytotoxic T cells, they took care of the situation? So until we test them, we do not know exactly what mechanism happened in them. But yes, this observation is correct. I have seen it as well. So there is Austin says, Dr. Bean, why am I a banana? Okay, I will have to research that. All right, so the Twitter is done. I'm going to look here for a few more questions and then we can break. A.I. Williams says, why do people ignore nanosilver for potentially reducing viral load? That I'll have to check. Why do they ignore it? I don't know, but I have to first research it to see what is the utility. So there is someone, Austin, who is insisting on being a banana and asking if why is he a banana? So Austin, be careful. I can block the bananas. So Luke says, note, I got ivermectin from a tele doctor and told him I had mange. Okay. So yes, so one comment here. I believe that Dr. Zelenko's Twitter thread somewhere has some folks who in various states are able to prescribe hydroxychloroquine. So you can talk with them. So Brenda says, how many hours of sunlight per day? So look, 20 to 30 minutes of sunlight with the correct sun angle and with the whole body can produce 10 to 20,000 international units of vitamin D. Rakesh says, Dr. Merrick said virus died after 8 to 10 days. Then why there is cremation problem in different country died by COVID-19? So I do not know what is the cremation problem. Cremation can be done. So Myron says, Dr. Said-Bean, do you know about nattokinase for clotting and fibrosis? No, I do not. I'll have to research. This is a good question. So 1x2 says, would the viral load reduce if you were to shine UV light up the nose and to the back of the mouth? So today there was a news that there is a dose of intensity of UVC light that is not harmful to human and still able to kill the virus. The problem with our mouth and nose area is virus is just not sitting outside. It is either in the mucous membrane fluids, or it is stuck to the cell, or it is inside the cells. So UV lights cannot do much to the virus that is already in the cell or is stuck to the cell. The cell has to be in its clear passage where it can kill it. So if let's say there are some cells sitting on viruses sitting in my saliva, on my tongue or cheek, and you shine a light, maybe there would be some reduction. I am not sure how much benefit will that have? Because virus is very quickly going to enter the cells and start dividing there. Because imagine this, that when we become sick, we have a small load of virus, one breath or two breath, that, or they say for 15 minutes you keep having breaths, but a few breaths come in and that virus then gets stuck with their membrane and infects us. So even if somebody has lots of virus and you shine the UV light, it may not be very beneficial. Okay, cool. So last few questions, and then we stop. So an Israeli population study found vitamin D drops were remarkably effective because of absorption in the oropharynx. What do you think? So I responded to that a few minutes ago as well. Yes, oral drops would actually cause the absorption right from here, from the floor of the mouth, and that substance would go to the blood supply right away without waiting to go to the GIT, then waiting to go to the liver, and then getting metabolized over there. So it is possible. There's a question from Austin. Can I have a cat? Absolutely. So Valerie says thank you. And so this is it, I think, for today. Perfect. So tomorrow we'll talk about omega. Austin says, and I'll enjoy my cat. Perfect. So tomorrow we'll talk about omega-3, and we'll talk about its role in long haulers. So thank you very much for your time. Thank you for sticking here with me. Please like, subscribe, and share. These are long videos, so I don't think many people share them. We can probably split them, but still, if you feel there is something useful that somebody can use and have a value from it, then please share. Let them complain that it is a long video. And thank you very much once again. See you tomorrow.